Today you have an appointment with your vet. Your dog is going to get vaccinated. Maybe you've wondered, is it really necessary to vaccinate them? They've never gotten sick. Well, if you're not too sure or you're just curious, this is the channel for you. My name is Alejandro, I'm a veterinarian, and this is Vet Story. There are many vaccines that are part of the annual vaccination and revaccination schedule. However, one of them is mandatory, and that's rabies. That's how it is in Spain, as well as in many other countries. Does that mean that just because the others aren't mandatory, they're not necessary? Isn't prevention something important? How would you feel if you only put on your seatbelt when you saw a police checkpoint on the road? Alright, next we're going to talk about these diseases, what they are, how they appear, and how to prevent them. If you're interested in this, stick around because we're getting started. First of all, and to better understand vaccines, we need to know what the immune system is. There are two types of responses, the innate response and the acquired response. In this video, we're going to focus on the acquired response, since that's the one involved in vaccination. Simply put, your dog's immune system is made up of little soldiers called lymphocytes, T lymphocytes, or B lymphocytes. The B lymphocytes, specifically, are responsible for producing antibodies. They patrol your dog's body looking for invading microorganisms such as bacteria and viruses. These have proteins on their surface called antigens. Once the lymphocytes find them, they produce specific antibodies to destroy them. Therefore, vaccines teach the body to recognize the threat without having to fight a real war by introducing a small amount of weakened, dead, or even just fragments of microorganisms. This way, antibodies and memory cells are generated. So when the body comes into contact with these viruses and bacteria, it knows how to recognize them. Depending on the material these vaccines contain, there are three types: inactivated, live attenuated, or recombinant vaccine. Alright, now that we have this part clear, let's talk about which diseases actually affect our pets. First, let's talk about distemper. Distemper is a disease caused by the measles virus in humans. This disease is not zoonotic, meaning it does not affect humans. The symptoms are quite general and hard to recognize: loss of appetite, diarrhea, vomiting, eye and nasal discharge. It can cause neurological symptoms like seizures and paralysis. It can have up to a 50% mortality rate. This vaccine is part of the main vaccination schedule and requires annual boosters. Next, we're going to talk about parvovirus. I'm sure you've heard about this disease at some point. Parvovirus is not a zoonosis, meaning it does not affect humans, although it is similar to the parvovirus B19 virus in humans. The symptoms are quite specific in this case. It causes gastroenteritis, bleeding, vomiting, diarrhea, fever, and loss of appetite. The reason this disease, parvovirosis, is so deadly among puppies is related to severe dehydration, reaching up to 70% mortality in unvaccinated puppies. It can last approximately 3 to 5 days if left untreated. It is highly contagious, and mortality in puppies can reach up to 70% in those that are not vaccinated. It is part of the core vaccines and the annual revaccination schedule. Canine hepatitis. Canine hepatitis is caused by the canine hepatitis virus type 1. No, this is not a zoonosis. This disease enters through the mouth and nose. Lymph nodes are replicated and cause inflammation in the kidneys, liver, and eyes. Dogs may experience diarrhea, vomiting, high fever, abdominal pain, swollen lymph nodes, corneal opacity, among others. Fortunately, this vaccine is part of the initial vaccination and annual booster program. Leptospirosis. Leptospirosis is caused by a bacterium of the genus Leptospira. This bacteria has different variants, all of which we vaccinate against. This is a zoonosis, and a very serious one at that. Humans can be affected through contaminated urine or contaminated water. Dogs and rodents are common sources of infection, and dogs can also be asymptomatic carriers, which makes them especially dangerous in terms of spreading the infection. It is one of the recommended vaccines. It is not part of the initial package, but often, depending on the location, it is given during the first vaccination and the annual booster. Imagine that your dog hardly ever leaves the house. You have a yard, and your dog does its business in the yard and not much else. Like today, you decided to go for a walk in the countryside with your friends. You step in a puddle where, without you knowing, rodents infected with Leptospira had previously urinated. You get home, leave your sneakers, and your dog, as usual, chews on them to play. You could get infected with this disease and, once it develops, potentially transmit it to you or anyone in your family. If seeing your best friend sick isn't hard enough, just imagine your family. The most common symptoms of this disease, generally speaking, are quite general, if you'll pardon the redundancy: fever, vomiting, lethargy, polyuria, and polydipsia, which, as we call it in veterinary medicine, means urinating a lot and drinking a lot, and jaundice. Jaundice is a symptom where your pet's mucous membranes turn yellow. This could be either the DUNS or the conjunctiva of the eye. If the disease has reached this point, we could be looking at liver failure and/or kidney failure. Rabies is a disease that was once very difficult to eradicate and killed many animals and people. It is a zoonotic disease that affects mammals indiscriminately. It is transmitted through saliva, usually by biting, and it is 100% fatal once symptoms appear. In dogs, it causes significant behavioral changes, lots of drooling, aggression, seizures, and even paralysis. In humans, it can cause headaches, fever, loss of appetite, and weakness. In Spain, it is practically eradicated, except for isolated cases in Ceuta and Melilla. As we mentioned earlier, this vaccine is mandatory in Spain, as in many countries around the world, and it is usually given again every 2 or 3 years. Kennel Cough is a respiratory complex. It is made up of different types of microorganisms. We have viruses like Adenovirus or parainfluenza, and bacteria such as Bordetella bronchoseptica. This disease is not zoonotic per se, but it can affect an immunocompromised human. This means, for example, people who have cancer, people undergoing chemotherapy, or anyone with another chronic illness. It's important to mention that this is one of the live attenuated vaccines used today. Therefore, if for any reason your pet isn't feeling well today, has been to the vet, vomited this morning, or hasn't eaten their food, they might be incubating something. If they're not 100% healthy, we never recommend vaccinating, since there's a risk of a reversion to virulence. In other words, after being vaccinated, they could end up developing the disease later on. It's not a deadly disease per se, but it is a very bothersome one. It causes coughing that sounds like a honk, dry cough, sneezing, and nasal discharge. It usually resolves within 3 to 6 weeks, and vaccination helps reduce the symptoms, aggressiveness, duration, and severity. The disease is highly contagious among dogs, so if your dog is going to stay at a kennel while you're on vacation, or you like going to the park because your dog gets along well with other dogs, we always recommend vaccinating. And that's it for the vaccines that are part of the initial vaccination protocol and annual revaccination. Of course, there are others, but we'll talk about them in future videos. Now we can get an idea of the vaccines you might encounter at the vet, the ones your dog is probably vaccinated against, and the ones I would strongly recommend you vaccinate your dog for, since as we've seen, some of them can even be fatal.